Let me introduce myself. My name is Narita Sari in a major of International Relations, batch 20 and 20. So today I'm going to present my speech about the government should spend more money on the health system during the pandemic. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Let's think, if we were a government, what strategy should we do for this pandemic? This pandemic situation brings affliction to many people. It affects several crucial sectors, significantly on the economy. Restrictions to hinder the contagion of COVID-19 considerably affect the country's revenue. The rapid endeavors are given as an attempt to turn the corner of instance, reopening some public places along with health protocols, touting campaigns to support local products, and so forth. We also can see that the government continuously gives several research to impacted workers. However, despite the existing support, I conjure that there is a sector that is impacted by outbreak is a health services. Whether on television or online, the news only provides the data of people killed by coronavirus, but not the health workers. It's only an example of how government neglects health services. So I stand here to persuade you to present three reasons why the government should spending more money on health services during the pandemic. So the first reason is the lack of medical supplies that caused a spike in the amount of mortality. Before coronavirus emerged to surface, a lot of people were hospitalized. As the COVID-19 hit Indonesia, most hospitals started to undergo a shortage of medical equipment, such as ventilators, protective gears, beds, and the medicines. Even the ICU or VIP rooms is shifted to a regular room to accommodate people with severe infections. According to World Health Organization, in 2020 warned a major shortage of medical equipment. It's also supported by the data from the interview conducted by the Jakarta Post, saying that the most hospitals need at least 200 protective gears a day. But it's left unmet. Besides, the ads do not come from the government but are sent by Singapore. It signifies that the government is unaware of the condition of health services. Hence, since medical equipment is crucial for health workers as well as patients, it is essential to expend more in fulfilling than before alleviating that tolls. So, the second reason is that the government needs to invest money into medicines and health checkup, especially for a COVID-19 test and the treatment, to be afforded by all classes of the economy. As developed country, it's crystal clear that there is a disparity in Indonesian's economic classes. Some people are in the lower middle classes and the rest are in the middle upper class. Commonly, lower middle class citizens have health insurance provided by the government, which is BPJS. In reality, it's not enough. The major problem appears when the hospital inhibits the process of BPJS and provide rich people as they have cash. This condition is supported by the Altarum analysis of health sector economy indicator or HSAL data, which stated that the price increased 4.8% higher throughout the outbreak than before the pandemic. If there is still discrimination and imbalanced treatment, I don't think that improvised people will survive because of the necessity to wait for the bpjs to be provided before checking their health. Therefore, spending money on medicines and health checkup is necessary to prevent a hundred life loss. The last reason is that the government should spend money on providing the most sophisticated vaccine. I think it's better for the government to buy the best vaccines and distribute them to the citizens without any charge. Um, I'll bet the decrease in coronavirus cases, but there's always a new variant immigrant. So let's take a look of the Omicron variant in UK. UK reports more than 400 cases of Omicron variants in UK. And then the scientists said that this variant poses a very high risk of infection compared with previous variants. And then on 16 December, government had found a first cases of Omicron in Indonesia. For this reason, we need a perfecting action which can be done by protection by citizens using the vaccine to tackle these variants. So in conclusion, overall, based on my agreements above, the three reasons why the government should more money spend more money on health system are due to the lack of medical supplies, that high price of medical checkup, especially medicine, and also the dangers of a new COVID variant. It's mean Omicron from UK. By having a deep elaboration for each reason, the government should be aware that all this time there are to focus on turning the corner of economy, but neglect the other impacted sectors caused by COVID-19. Hereby, with the argument and supporting facts that I have been talking, it's essential for the government to take a look and start consider the health system, unless they want to pay the loss of 1,000 lives. So I think that's all that I could say today. Thank you and wassalamualaikum warahmatullahi